This is Fox 13 Business Now.
We are here at Hoops Vision today with Dr. Bradley, and they have a new cutting-edge technology for laser treatment for corneal transplants. So tell us a little bit about that.
Well, there's actually two really exciting things that we're doing with cornea transplants. One is to leave behind the most delicate part of the cornea, which is this very front curvature of the eye. We leave behind the most delicate part so that there's less chance of the patient rejecting the new cornea. And the other is that instead of using a steel blade, we're using a laser to cut that corneal tissue, and we're able to cut it in any shape we want. We cut it in a zigzag pattern. That lets these two pieces of tissues lock right in together and be stronger and align better afterwards.
Sounds like a lot more precision.
It really is a really precise technology we can cut with the laser.
And you had a patient that had great success with it.
Yeah, there's a patient named Alan who has a condition called keratoconus, where that curvature of the cornea gets bulgy and irregular, and he needed to have his corneas replaced. And we used both of these new techniques with him, and it's been a great compliment to him in having a better recovery and less chance of rejection.
I'm here with Alan, and he's a patient who underwent this type of surgery, laser surgery. Tell us what life was like before.
Life was, it was nice to be able to see, but I had to wear these cone-shaped contact lenses to be able to see, and each year the cone shape got a little bit more pronounced, and eventually, after 18 years, my body started rejecting the contacts.
And your first procedure by Dr. Bradley was performed in March of 2011, correct? And
yes.
You did one eye at that time, and then 6 months later, you were treated with the other eye.
Right.
So tell me, what has that been like for you?
Procedure remarkably easy, and the recovery was very quick, and it's changed my life. I don't have to spend time at night getting ready and preparing my eyes, and in the morning I just go out the door.
And you don't wear anything now?
Nothing corrective at this time.
So is Alan's condition common?
Yes, this condition called keratoconus is pretty common, especially here in Utah. And what you tend to have is people can't see well even with glasses, and it just deteriorates more and more over time.
So how would someone know they have the condition?
You really need an eye doctor to tell you. But one of the first symptoms is not seeing well even with glasses.
Okay, and it's hereditary? Is that why it's more common in Utah? Or?
It's at least partially hereditary, and you'll see families that have multiple family members that have keratoconus.
Okay, and the good news is this is a lot less invasive way to get results, and the recovery?
The recovery can be a little bit faster, and you have less chance of rejection.
Okay, so for this condition and to find out more about this cutting edge technology, visit Hoops Vision at www.hoopsvision.com.
This has been Fox 13 Business Now. If you'd like your business profiled, call us at 801-536-1333.